Hey everyone, I'm Rob Maggio, and I am here at Therapy on the Rocks, John Barnes' Western Myofascial Release Treatment Center in Sedona, Arizona. I'm going to go over some self-care techniques that John has actually taught in some of the different classes for your hands and for your arms and pretty much for your whole body. We teach these to patients and we teach these to therapists. I'm here in our avalanche room, which is one of our treatment rooms on the first level of Therapy on the Rocks. I picked this room because Sheila Walker did a virtual tour of the clinic the other day, and she mentioned some of the artwork here in the clinic. I really enjoy the stained glass piece that John had put in this room a few years ago, and so I figured I would use that as my backdrop. But let's get into the techniques. At Cervical Thoracic, John teaches a great technique for your hands that you can do all of your hands at once, or you can do them throughout the day. This is an excellent technique that pretty much you can do anywhere you have a few minutes just to spend some time with your hands. The first technique, or this technique, is starts off with you actually just taking your finger and rotating your finger one way and then the other. What we're doing is we're assessing the direction of ease and the direction that has the most resistance. Once you figure out which direction is the direction of ease, what you're going to do is rotate into that direction and then gently compress the finger in toward the wrist. And then what we're going to do is we're going to wait, like pretty much we do with every one of our other techniques. We're going to wait for the tissue to start to unwind and release. When that happens, we may be able to rotate a little bit more. We may be able to compress a little bit more. We'll just follow the tissue and see exactly where it goes. We're going to get a few releases in this direction, and then after we've got those releases, then we're going to take it in the opposite direction, which was the direction that gave us the most resistance before. But then instead of compressing, what we're going to do is elongate. And we're going to follow the same thing, the same pattern that we did before. We're going to wait for the tissue to release, and as it releases, we may elongate a little bit more, we may rotate a little bit more. After you've gotten a few releases in that finger, if you have time, you can go to the next one. If you don't have time, that's fine. You can go back to doing whatever you need to be doing, and then the next time presents itself, you can go and do your next finger. Again, you want to go through all of your fingers eventually throughout the day and go through both hands. Your fingers will definitely really appreciate it. Another technique that John has actually taught us for the arm as well as for the entire body is a technique he just started teaching at the fascial cranium class. If you haven't gone to the fascial cranium class yet, I really encourage you to do it because it's a pretty amazing class. But John teaches us a Hoku point technique that I think is pretty amazing. The Hoku point is an acupuncture point that's actually found in the web space of your thumb and your second ray. So what you're going to do is take one of your hands and make a pincher grip with a couple of fingers into the meaty part of that web space. That's where the Hoku point actually is. And then what you're going to do is you're going to start to pull that Hoku point out toward the fingertips. As you do that, if you can elongate your arm and turn your head away from the arm that's being treated, you'll start to feel the releases start to go from your web space all the way up your arm and actually into your neck. If you have time to do it, let your arm and your neck unwind and just go through that space. This is a great technique for general pain throughout the body. People talk about the Hoku point also being used for the headache, but when I do this, it just seems to relax my hands, and so that's why I'm sharing it during this video. The only warning I have about this, acupuncturists say that this is an area that actually induces labor. So if you're pregnant, you probably want to stay away from compressing your Hoku point until your babies are born. Going back to the cervical thoracic class that John teaches, he does a great technique for the plantar surface of your hand, or the palm surface of your hand, your fingertips, and also your carpal tunnel. And it's called a hand glide. What you do is take the hand that you're going to work on and extend your wrist. Place your other hand on top of it, and then just gently kind of compress in toward the palm. And then what you want to do is you want to shear the top hand on top of the bottom hand. This is going to open up the plantar surface of these hands as well as kind of getting into your carpal tunnel. Wait for a few releases, come back to neutral, and then do the other side. And again, this is something that could be done for a few minutes throughout the day, and it will definitely open up your wrist and your fingers and your palm. And your hands will love you for it. Then another way to kind of get into this area is like a Namaste type of pose. pose. What you can do is place both your hands together in front of your heart or in front of your chest. And then what you can do is allow to see if you can drop your wrists down toward your pelvis without your hands coming apart and letting your elbows come up. A lot of times people are focused on this and they don't realize that their shoulders jack up. So relax your shoulders, find your barrier of tension, and then just wait for it all to release. This is a great technique for your forearms or the top parts of your forearms too. If you want to get into the bottom parts of your forearms and then this side of your hands, place your hands together like this. And this time what you're going to do is try to lift your wrists up towards your chin and have your elbows drop. And I said try because I'm really tight here and I really can't do this that well. But you get an idea. Again, when you start working too hard at this, you're going to start to tense up in different parts of your body, your shoulder, your neck, maybe even your jaw. So check in with yourself and see where you're holding tension and see if you can soften and just feel the releases right over here. So we've worked the arms, the fingers, or the hands, the fingers. Now let's get into the arms and the whole body. John teaches us just basically to elongate our arms, extend our wrists, and gently start to lengthen through our arms and through the heels of our hands. As we do this, we're going to start to feel some motion that's going to happen in our forearms, in our arms, in our fingertips. And what we're going to do is just allow our bodies to follow that motion, follow that length, taking us wherever we need to go. This will kind of open up everything for us all at once. So if you have the space and the time, this is a great thing to do a couple times throughout the day. So those are just a couple of the techniques that John has shared in different classes. And I'm hoping that you guys can utilize these throughout your day and share them with your patients too. Have a great day, and we'll talk to you later.